Hello, good evening. This is Ellen Teeter. I'm the Executive Director of FSOMA, and we have some news here for you tonight. So we'll get started. I've got David Bibby, our president. Tony Crail's going to be here to talk about some news about the medical legislation that's happened. And Joshua is going to talk about the Board of Acupuncture meeting. And we've got a couple of other items to cover. So we're so glad you're here. Welcome. The chat button is for you all to communicate with each other. The Q&A button is to ask questions, and we'll try to get to them later. But let's just go hear now the news. The FSOMA conference is coming up. FSOMA members, if you contact me, don't tell David, but I'll give you the early bird rate if you haven't signed up yet. And we'll get you into the conference. It's going to be a great one, August 13th through the 15th. You can go to FSOMA.org and look for this logo, or just go straight to FSOMACon.com. A couple of things we're doing at there is, if you're not going to the conference, you can register and attend the General Assembly and receive 2 free CEUs. So just know that, we'd like you to come to the General Assembly. It's industry news from around the country. Also, if you're an ATOM or AMC alumni, we're holding a reunion on Saturday. And look at the FSOMA.org website to register for those. We'd love to have you there. Next year, when we're back in Orlando, we'll hold a reunion for EWC and FSOMA there. So, all right. And here we go, David. David, can you hear me?
Everybody, I have some remarks from the, I can hear you.
Okay, you were frozen for a second. Okay.
Yeah.
Okay, I'm sorry. I had some remarks from the Advocacy Committee, our summer campaign. And Jennifer Broadwell has been doing a tremendous job rolling out different phases for the advocacy program. But this summer is usually the time for meeting with our elected officials, legislators for the House and State Senate in their district offices. And so in the third quarter, district meetings with your legislator is a priority for board of directors here, the board for FSOMA, as well as for membership. Everybody has a stake in at least knowing who your elected legislator is, meeting with them, shaking their hand, congratulating them on being elected, learning a little bit about their legislative agenda, and of course, introducing yourself as a resource for the acupuncture profession. If they have any questions, the staff should know how to reach you to provide input about legislative matters. It's always a good time to develop relationships with legislators. District meetings can be an opportunity to do that. The legislative report had an update that Ellen is scheduled with Representative Wilkinson for July the 26th and planning on attending a fundraiser for him September 29th. Senator Jim Boyd is not making appointments until September. And you'll see that sometimes the senators are busy or the representatives' offices are busy. And if you call for a constituent meeting or some face-to-face or Zoom meeting, they may put you off for a month or 6 weeks or more. But you just, be persistent and just tell them, say when it's convenient, I'd like to be on the calendar. And their staff is usually pretty good about getting back to you. Jennifer Broadwell's meeting with Senator Tina Polsky down in her district. She met with Representative Schlossberg on Tuesday via Zoom, and they had an opportunity to discuss recent legislation that Representative Schlossberg had co-sponsored. So Jennifer, on behalf of FSOMA, thanked her for her initiative in serving the citizens of Florida, and they spoke about healthcare issues and the need for increasing access to care and various ways that licensed acupuncturists can improve patient outcomes, and particularly by offering non-opioid effective options for pain treatment and longer. This is Representative Schlossberg was very open to listening and welcomed the opportunity to learn more about how acupuncture can benefit Floridians. I think you'll find that that's a fairly common attitude when you have a face-to-face professional discussion with legislators. They're there to advocate on behalf of their districts, and if we can find safe and effective treatments for health concerns, they usually want to hear more about how we can do that. Next slide. I also wanted to mention that we had something interesting happen this year in the state. The legislature, the House and the Senate has been working for the last couple of years on revising the auto insurance laws in Florida. And for acupuncturists that have been around for a while, they'll remember that there was a time under the PIP, Personal Injury Protection, part of Florida law that included care from acupuncturists. Those benefits were taken away around 2011, 2012. And but the PIP has persisted, and it's some of reimbursement or making money available for people who are involved in auto accidents that have injuries that require, or to rule out injuries, they have medical expenses. And so the legislature has been looking at other state models for bodily injury, which is an alternative method for insurance companies to make money available or for people to file claims for injuries. Anyway, Florida is a PIP, injury protection, and the state and the House of Representatives and the Senate got together and they put together a bill to eliminate PIP, because it's not a perfect system and there's a lot of waste, fraud, and abuse in there, and it also can drive up the cost of certain types of automobile insurance. So the House of Representatives, as a body, the legislature, had developed new legislation to replace it with bodily injury, which is basically a situation where if people have an auto accident, if they need to go to the emergency ambulance, take them there. But for people who walk away from an accident, if they feel like they've had physical injuries, they contact an attorney. An attorney represents them and in helping access healthcare treatment options. And so while the PIP system has flaws and the Florida law regarding bad faith is deficient, this is a quote here, Senate Bill 54 does not adequately address the current issues facing Florida drivers. This is from Governor DeSantis, his comments. It may have unintended consequences that would negatively impact both the market, meaning insurance companies, and consumers, people traveling the highways and byways of Florida. And so he used the only veto that Senator DeSantis used this year was to reject the introducing a bodily injury replacement to PIP in Florida, which raised a lot of eyebrows because there was no real objection to this change, through the legislative process. But when the bill hit his desk, he chose not to sign it. So PIP remains the law. And from an acupuncture standpoint, to me, I know there's various ways to look at this. The advantage, if you would, for the acupuncture profession would be that under PIP, we were eliminated as providers that could be reimbursed under the process here in Florida. And by eliminating that, it also eliminates chiropractors and PIP money available for emergency physicians and other types of medical providers. So it sort of levels the playing field. There's no winners and losers, if you would, under the PIP system, the way it is now, where massage therapists and acupuncturists wound up on the short end of the stick, and chiropractors and emergency medicine remained available to PIP. Going bodily injury would have eliminated that distinction. But for the time being, interestingly enough, PIP remains the law in Florida. So says Governor DeSantis. And so look forward to maybe another opportunity to look at insurance legislation here. That's my comments there. Next slide.
Okay, hi. I am going to talk about some other legislation that passed. And on April 2nd, Governor DeSantis signed into law Senate Bill 2006. This was a bill to protect medical freedom, and it became known as the No Vaccine Passport Bill. SB 2006 and similar bills that were filed in 48 states across the country during the 2021 legislative session address COVID vaccine mandates and the use of health passports to prove vaccination status for work and school and travel and right of access and to get health care and things like that. The executive order for SB 2006 is actually very beautifully written. You can read there that it acknowledges that some people may be unable to obtain a COVID vaccination due to health, medical, religious, or other reason. And it states that no COVID vaccine is required by law. It declares that medical information is private information and should not be shared by mandate. And it expresses the concern that the requirement that citizens show proof of vaccination threatens individual freedom, medical freedom, and patient privacy. It was a big win for medical freedom and privacy. SB 2006 prohibits businesses, government agencies, and educational institutions in the state of Florida from requiring individuals to show proof certifying COVID vaccination. Some details about this legislation that is worth noting is that SB 2006 was originally a bill to revise the State Emergency Powers Act, to remove a provision in that act that authorizes forced vaccination in emergencies. And that part of the bill remained unchanged. Also, the bill does not restrict businesses, agencies, and educational institutions from implementing screening protocols per government guidelines to protect public health. Furthermore, the bill was amended during session to exempt certain medical facilities and providers from compliance, which means that certain medical providers and facilities can require documented proof of to certify vaccination. What we can look forward to during the next session, hopefully, is some new legislation to further protect, will provide more employment protection and insurance protection, and to the right of access to be more clear about providing some of these other things. So in terms of where we are today, while many states are passing no vaccine passport bills and similar health freedom legislation, mandatory vaccination policies are being implemented and digital passport systems are being developed and tested for tracking this health information. It's not clear yet how all of this is going to work, and obviously there's some legal issues, but for now the question on everyone's mind is, can the employer require the vaccine? So the EEOC has issued specific guidance on this, and they allow for employer mandates, but they recommend that the employers offer vaccines to employees on a voluntary basis as opposed to implementing a mandatory policy. If the employer does mandate vaccines, the guidance indicates that the employer must consider reasonable accommodations for employees with disabilities and other medical issues, and those employees whose religious beliefs conflict with receiving a vaccine. And the next slide. So basically, they have to make accommodations, but can they ask you if you received the vaccine? And again, the EEOC has issued their guidance and said that they are permitted to ask. And can they refuse? Can they be fired if they refuse it? And so this is what's important about having a medical or religious exemption, which this legislation, this type of legislation is, trying to protect. So absent that, they could feasibly terminate employees. But again, no one really knows how this is going to, pan out. But to add to what David was saying, it would be, in order to make sure that we continue to get more of this healthcare freedom legislation, we should call our legislation. We should thank them for passing 2006 and for their commitment to healthcare freedom. So thank you.
Thank you, Tony. Joshua is going to tell us about the Board of Acupuncture meeting this last quarter.
All right, yes. So a Board of Acupuncture meeting was held on Friday, June 25th. As you see, we have a few new members of the board, even our own Amy Sear, who teaches the laws and rules classes at the FSOMA Conference each year. Okay, we can move on. All right now there aren't any particular rules under consideration, and the vast majority of this meeting was all around licensing applicants who are trying to practice in Florida. Okay, and so as far as licensing issues go, there were a few voluntary relinquishments of their acupuncture license due to some practitioners who were convicted on sexual molestation charges, and so they're no longer able to practice in the state. There were also 5 other out-of-state applicants trying to get a license to practice. They were doing this by endorsement, in which we or look at their NCC-AOM certification, as well as the rules in the state that they were licensed in compared to Florida licensing requirements at the time they were licensed. And so if there is any sort of deficit, the board is generous enough to let these applicants, take the required coursework in order to meet the Florida standards. There was one applicant in particular who was just completely denied because he was practicing without meeting these requirements and without a Florida license in the state of Florida. And he was pretty much caught twice for this. So his license was completely denied. And that is all I have to report on at this time.
Thank you, Joshua. Thank you for going to that meeting and for being there. The SARS Society for Acupuncture Research Conference was June 14th through 17th, and it took place virtually, and it was pretty much multiple locations around the world. The theme for this year was pandemics, pain, and public health, roles and relevance of traditional East Asian medicine. And they focused on modalities, response, and research related to COVID-19 in relation to Chinese medicine, mental health, and epidemiology. There were a lot of papers presented, posters. We are trying to get posters for the FSOMA conference, but it's been difficult. The keynote speaker, one of them was Dr. Helene Langevin, who's the director of the National Center for Complementary and Integrative Health and a professor in residence of medicine at Harvard Medical School. And Dr. Peter Wayne, also from Harvard, and a director of research for the Osher Center for Integrative Medicine, presented some new strategic plans of the NCCIH. It's centered on the perception of whole person health, and they discussed how the new approach is a whole person approach to acupuncture research to align the concept. So it was a great conference, very research oriented. Now we, as a FSOMA member, you've been getting the Meridia JASA journal. If you go to your benefits site, there is a place to click and look at all the past issues. For a while, it was an independent publication. Then it became part of JASA or the ASA, but now it is ceasing publication. And in sort of taking its place is the medical acupuncture journal, which is the medical doctor research journal. And they are going to be including us and research from us in their journal and opening it up in the future. So you will be having access to that as a FSOMA member. They're going to give 5,000 members and student members of the ASA free and open access to the content. So I believe that should cover us as well. There's also going to be the possibility for 2 members to search for research online and be sort of specialists in research. We have 2 association members who are going to take on being connected with the new journal, and that is Gretchen Gonzalez and Galina Rufner. So they will, as this develops, we'll try to let you know more, but we should be able to post copies of the journal on the website, just like we have been doing the JASA journal. So that's a little bit of a change. One thing that happened is FSOMA got all the material on how to do research and links that used to be on the JASA journal site. And we've now moved it to a web page in FSOMA, and I should be making that public soon. So that is the news. Are there any questions, comments? I don't see any questions in the chat or the Q&A. Oh, David Bibby raised a hand. Let me see if I can find him. Maybe I need to bring him back in. David, you can talk.
Thanks, guys. I apologize. I just wanted to let Ellen and Tony and Joshua know that for technical reasons I was booted, but I was able to circle back onto the Zoom platform as a viewer. And if there's any questions related to the comments that I made, I'm available for a few more minutes. Okay.
Okay. Thanks. Yeah. Start trying to connect with your legislator. You try to email them, try to call them. You need to use all the mechanisms to get to them. Sometimes you have to email them, follow up with a phone call, and then email to a different address. So, but it takes a little perseverance sometimes. Try to get on their mailing list. If they have a fundraiser and you can go and take some other acupuncturists with you, that's a good way to kind of connect, get to be friends with them. You know, donating money does not guarantee anything, but it gives you a little bit of access and a little more attention. So, all right. There's something in the chat. Any updates on healthcare workers wearing masks? David, do you have anything on that? Let me see if David's still here. Yeah, David, you should be able to talk.
There's no change in status on that.
What is the status right now in case?
There are physicians' offices who use masks, their staff use masks, they have their doors locked, they greet you at the door with a temperature check still. And then there's others that are completely wide open. And so I'm sorry to say that, you know, whatever the best practice is, whatever the Department of Health doesn't, as far as I know, have a position on it. The CDC, I heard tonight, was just made an announcement that they were not going to make any changes to public statements or guidance previously made, irrespective of, you know, increased hospitalizations and increased reporting for variants. They're like, you know, they're acknowledging that certain parts of the country are experiencing surges in communication of COVID-19 and its variants, but they're not making any changes. So I'm sorry, I guess I don't want to sound all over the place. As far as I know, in Florida, Governor DeSantis has had a very relaxed approach and said, basically, in this instance, healthcare practices aren't being treated any differently than other practices. If you're part of a hospital group and for liability or other reasons, they think posturally they should be masked up, that's what they're going to do. but there's nobody gonna enforce a rule one way or the other. So I come back to, if you are a family member or somebody that you're concerned about, a staff member that you want to take extra precautions with, we know what the standard precautions are in terms of both PPE and universal precautions. You can use the full complement of that in your office, all the way down to, standards that were common prior to March and April last year.
Thank you, David. Anything else? I don't see it. Thank you all for being here. If you have questions about the news, you can email support@fsoma.org. We'll get back to you. You can always contact me at director@fsoma.org or the 800 number, 800-578-4865. It's all on the home screen contact us button on the website. So let us know how we can support you, and thank you all for being here.
Thank you. Thank you, Ellen.
Thank you. Bye-bye.
Bye.
Bye.